Today we will be looking at some of the muscles used in the action of crossing the street. We will specifically be looking at 5 of those muscles. They are the trapezius, the supraspinatus, the semitendinosus, the rectus femoris, and the sternocleidoid mastoid. We will begin with the trapezius muscle, focusing primarily on the superior portion. Its origin points are the external occipital protuberance and the cervical vertebrae. It inserts into the lateral portions of the clavicle bone. Its job in helping us cross the street is going to be bringing our head upward from a bowed position away from our cell phone. It does so by extending and bringing a greater area of articulation. Now that we're looking up, we will want to let the lights know that we wish to cross. We will do so with the supraspinatus muscle. Its origin is the supraspinatus fossa of the scapula bone. It inserts at the greater tubercle of the humerus. Its job in this process is going to be to help in the abduction of the arm and to hold and stabilize the humerus as we press the button, letting the lights know that we wish to cross. We now receive our crossing indication and wish to look both ways before crossing. We will be using our sternocleidoid mastoid muscle, and they are found on both sides of the neck. Its origin points are the manubrium of the sternum and the medial portions of the clavicle bone. They insert into the mastoid processes of the temporal bones on each side. Now, depending on which side you wish to look, you will actually flex the opposite side's muscle. For example, when looking left, you are flexing the right sternocleidoid mastoid. And when you're looking right, you're flexing the left sternocleidoid mastoid. Now that we have looked to both sides of the street, we will want to move across. During this process, many things are going on, like the shifting of weight and the production of forward momentum. We'll be looking at 2 muscles that help in this process. In the first part, we'll be looking at the rectus femoris, and in the second part, we will be looking at the semitendinosus. In the first part, with the rectus femoris, its origin location is the anterior inferior iliac spine, and then it inserts at the patella and the tibial tuberosity. Its job in the first part of the process is going to be to flex the thigh upward and to extend the leg outward. Moving to the second part of the process, we have the semitendinosus. Its origin location is the ischial tuberosity, and its insertion point is the proximal medial tibial portion. Now, moving back to the first process, in the second process, the semitendinosus will actually extend the thigh downward and flex the leg backwards. This will continue to happen until we make it across the street and have completed our actions.